Welcome back to My Story. Before we sit with Guam Cancer Care, let me share a few things about them. They provide free professional support services to any Guam resident adversely affected by cancer. Their programs include patient navigation and advocacy, screening, partial funding, counseling, support groups, education, and transportation coordination. The nonprofit organization was created about 5 years ago for the primary purpose of bridging the gaps in services that Guam's cancer patients face. So let's take a look at my chat with Guam Cancer Care. So welcome to My Story. Guam Cancer Care obviously is a big part of the cancer community, and a lot of survivors and warriors go through you guys. But can you just kind of explain what Guam Cancer Care is all about?
Okay. So about roughly almost 5 years ago, we did this on our own time. A group of us, there were 6 of us that did it on our own time in March of 2011. At that time, we were actually working in at the radiation center.
Island Cancer Center.
Oh, okay.
Both Olene and I and one of our other founders, who was our program director at that time. So we kind of made this group of people, and through our employment at Island Cancer Center, we kind of saw how hard it was for our residents here to get the necessary treatments or resources that was needed to go through cancer treatments here on Guam. We were lucky enough that Christina, who is our nurse at the time, she came from a hospital in California who had a navigation group specifically for cancer patients.
Oh, okay.
So through her and our radiation oncologist at the time, Dr. Paliuka, they actually introduced us into patient navigation.
So there was the patient navigation in California. So that's kind of modeled after what the group is in California.
Right. Navigation in the state side is different from Guam Cancer Care in the sense that navigation groups in the States are more hospital-based. So they cater to their demographic, their patient base. But with her knowledge, we were able to cater it to our residents here on Guam, utilizing those same resources that patients in the States have. Once we've established that they are eligible, residents from Guam were eligible.
Okay.
So through the knowledge and the guidance of both Christina and our radiation oncologist at the time, we were able to start communicating with national pharmaceutical companies as far as oncology medications and seeking financial resources at the national level.
So is this sort of like a nonprofit?
We are a nonprofit. We were established as a nonprofit. We are funded now, we were funded initially in October 2011 through the Guam Cancer Trust Fund, which through the tobacco sin tax, that's where the monies come from.
Okay.
Yeah.
How about federal funding? Do you guys receive federal funding?
We do not. We are 100% locally funded.
Oh, wow. Okay.
Yeah.
That's amazing. Okay. So a warrior or somebody who's afflicted with cancer or maybe afflicted with cancer, what should they expect, or what can they expect when they walk through the doors here?
First and foremost, when they do walk in, majority of the patients that do come through our offices already have some sort of knowledge about us. We do, very rare we get those patients who just walk in on their own. So once they come in, we have them register. We do have a checklist of documents that we would need based on what they need need assistance on. A lot of times we just advise them, check mark all, and we'll see what we can do. Under everything that is in our capacity under the rainbow, we will do for that patient. All of our services are 100% free. The only thing that we require is the patient's acknowledgement and registration. Of course, because dealing with direct services, there's a lot of laws involved, like as far as HIPAA and all that good stuff. Once a patient is registered, we do an intake with that patient, have a one-on-one with an assigned navigator. We will basically see what that patient needs and then go from there, take our cue.
These patients that come in, do they also get referrals from their doctors? Sometimes
we do get a good number of patients that come from the local oncology clinics on the island, and then we do just have some it's word of mouth through other family
okay.
members or friends that are also afflicted with cancer or know family members who are afflicted with cancer, and then they send them here.
Okay, I see. So what about, so when they come in here, they register, you know, they are seeking services. What kind of services do you offer?
So we have patient navigation services. That's our bread and butter, patient navigation. It's like the word navigation. So we're navigating their cancer treatment with them. So if that means that they need assistance, scheduling appointments, making arrangements for diagnostics, figuring out what lab takes their insurances, if they were prescribed medications, trying to source those medications, whether we can receive them here locally, or if we need to go further and reach out to the national level. With navigation, we always like to joke around and
tell them we're
your personal assistants.
Whatever you need, we're here to try and make it easier for them, because
it does help.
Yes, with us, we try and make it where their concentration is on themselves and getting their treatment. So all that necessary paperwork that is needed to ensure those treatments or getting their medications or their financial assistance, that's our job, to try and eliminate that process for them, and we'll take it on. Right. We'll take that responsibility on for them.
Yeah. So kind of the burden
is taken
off their shoulders
and shifted to us.
Yeah.
Okay. And that way they can just focus on their health, getting better,
Right.
maybe spending more time with family.
Right.
Yes.
And all that stuff. Okay. So when they first come in, I know you said that they register, but what are some of the things that they should bring with them? Should they bring patient records?
Patient records is not necessary, only because once they are registered, we have the necessary documents to request those records from the oncology. Okay. A lot of times it's hard for them to go to the doctor and say, I need this clinic note to bring it where and where.
Sometimes they get charged.
Yes.
Yes.
So rather than them doing that, we just have them do the registration packet, turn it in. We'll request everything else that we need that's clinically related.
Okay. What about their family members? Is there any involvement on their end?
Oh yes, very much so. I think it's us being from here, we're all about family. So whenever a family member can help, it's so evident here, like on Guam.
Speaking more on services, can you give us an idea of, I know you said that it's almost like you're the personal assistance for these patients, but what about, like, for example, if they need a ride to their appointment? Is that something that you provide?
Yes, we do provide free transportation.
Okay. Wow.
The only requirements that we request from the patient is just to get a referral from their clinic, and that just gives us like at least a breakdown of their schedule, of what their schedule is going to be throughout the week or the month, depending on how long they're going to be in treatment. And then we have a driver that will coordinate their appointments, and then he'll ensure that they get to their appointments and then back home at the same time.
Wow, that's very nice. Yeah. That's amazing.
So referring back to our services, navigation is like our bread and butter, but we do have a financial assistance program as well.
Oh, okay.
So for the financial assistance program, we do require documentation just to qualify a patient. And how that works is once they bring in their income documents, our navigators are trained to assess them, and we can award them anywhere between $200 and $1,800 a quarter. Okay. And that it doesn't get paid to the patient. We make arrangements with all their providers so that we can ensure that they are actually going through with the treatment.
Oh, okay. So the payment is made directly to their providers.
Correct.
I see. Okay.
It's like a copay assistance.
Yeah.
Right.
So instead of the patient being billed their copayment at the end of their visit, they will bill us.
They will bill you.
Yes.
Okay. And then up to $1,800 is
or whatever
per
amount they're awarded throughout that quarter.
Okay. And so there are, I'm assuming, eligibility requirements for this.
Yes.
Can you go over some of the requirements for it?
It's really based on your income. We don't look at assets. It's purely just what your income is for that month. Yeah.
Okay.
And then we break it down from there. We do follow. We do have a methodology in doing so. And then at the end of that process, then we're able to say, Mr. John Doe, we are able to assist you up to X amount, and this is how it works. We will assist you with your copays at chemotherapy, radiation therapy, pharmacies. Durable medical equipment supplies shops if that's the case, if need be.
Okay. Yeah. What about, I know that you work locally with some of the local oncology clinics here in Guam. What if somebody needs off-island treatment? Is that something that you can facilitate for them as well?
Yes, we do help. We do assist in the coordination of off-island care. We work with both the oncology office and their insurance companies.
Oh, okay. Okay. So what are, I'm assuming Philippines is one destination that is common. How about in the States?
Yes,
Philippines, California, and Hawaii.
yes,
And Hawaii.
all
Okay. Okay.
We do have those few that go to like other hospitals that may not be in the provider networks, and we'll assist with that as well.
I see. Now, if a patient, someone who just gets a new diagnosis that they have cancer or some kind of tumor, what should they do if they're thinking, where can I go, a support group, who can they call, what should they do, what kind of questions should they be asking?
I'm sorry, trying to think. Newly diagnosed patients, a lot of times if they do come here as their first stop, then we would lead them in the steps. But majority of the times when they come here, they've already seen someone.
Right, they have some sort of knowledge.
Right.
I see.
So it's very rare we get one that just gets diagnosed and comes straight here. But we do get them every now and again.
Okay.
Normally, their first stop is usually the oncology clinic. And
Right.
then from there, they come here.
Yeah.
Okay.
And then we coordinate with them whatever assistance they may need throughout their treatment process.
Okay.
But when we do get those newly diagnosed that are straight from their primary here or their surgeon's office here, then we would get in contact with their primary or surgeon staff, and then figure out from there if they've discussed with the patient the option of either doing their treatments here or off island, depending on the type of diagnosis.
I see.
Because not all treatment modalities are available for every diagnosis here on
Right,
island.
here on island. And so, you guys have been around for about, 5 years
Going
now?
on 5 years. Yes.
And I know a lot of people talk about Guam Cancer Care and the amazing things they've done for the community. How many patients have you helped over the last 5 years? Do you have an idea?
Yes. Since our inception, we have registered over 800 patients.
Wow.
Of course, all 800 are not all active at the same time,
Right.
but yes, we have registered over 800 patients.
So
since our
800
inception.
patients that have come through the door,
Yes.
asked for your help, and you've provided assistance
Yes.
to them. And what are some of the comments and things that you hear about the services that you provide?
We pride ourselves on being our patients' friends, on top of being their help, assistants.
Yeah.
So even when patients go into remission, they still come
They
here
still
just
come
to
back.
hang out.
Yeah.
Or they invite us to their barbecues
right.
or whatnot. We've always heard good comments, but then that's always to our face. So,
Yeah, we don't know what they're
nobody
saying behind our back.
Yeah.
But I hope it's all in good favor. But because aside from like the financial assistance and the transportation that Ellie had mentioned, there are other resources or services that we also provide for patients. We do supplies for patients. I know patients who are usually require nutritional supplements. I know that could be very expensive
Yes.
on their part.
Yes.
So that's also something that we can provide for them.
Because sometimes the insurance company won't.
Yeah, it's not a covered
Covered
benefit.
right,
it's something they would have to go and pick up
At the store.
at the store, and that itself is expensive. So that's something else that we can provide for them. And we also have a lot of other supplies that we can provide for the patients.
Okay.
So it's pretty much, we always tell our patients, anything your provider asks you to do or pick up or
anything
fill,
you might need, you just
Yeah,
let
just
us know.
let
and
us
we'll
know first,
And
so
we'll
we
see what
can-
we can do to provide it for you.
Yeah, rather than trying to take on
This is all age groups.
all age
All
groups.
age groups.
Anyone.
Yes.
Yes.
Okay. All right.
Yeah.
Thank you so much, ladies.
You're welcome.
Thank you for having
us.
Hafaden, welcome back to My Story. Joining us today is Miss Leilani Pakaigui. She's a warrior. She was diagnosed with cervical cancer, and she's here today to talk to us about, the diagnosis and what her life was like before and after. So I'm going to start off with, prior to the diagnosis, I understand that, you just had a baby a few months ago, and so earlier you were mentioning that your doctor had detected something with you prior to you getting pregnant. Can you tell us about that? How they detected it? Was it through a pap smear?
Yes, they did. They actually picked up an abnormal pap smear result, to which my clinical physician actually referred me to the gynecologist.
Okay.
And then I sought services over at SDA clinic, and that's when I met my doctor, Dr. Miller. We had already did consultation in regards to the normal pap result, and then she did one again, and from there we've been discussing other treatments as far as colposcopies, conization, and we just kept going from there.
Yeah. Now, you mentioned that it was through a pap smear.
Yes.
Initially. Were you getting pap smears regularly? You know, doing your regular wellness checkups and all that?
Prior to that, I honestly, maybe not in the last couple of years. I mean, the last time, I really honestly thought that with everything going on, the years going by, the time going by, and having to deal with, you know, changes throughout the years, lost track of time, lost track of, you know, having to make sure that was taken care of, and that we were doing that.
And you are a mom of, prior to your newborn, a mom of four.
Four, yes.
4 daughters. And so that does indeed keep you busy.
Yes.
Yeah.
So I can honestly say the last time I had it was when my youngest daughter was born.
Or
Yes.
around that time.
Around. And she was in her like toddler years.
I see.
3, 4 years old.
Okay. And that one was normal. There were no...
Everything was normal.
Everything was normal.
The last one I had was, we did have an abnormal, but it was a low grade.
Oh, okay.
And I was referred, and like I said, I've been so busy. We moved, we had our house set up in 2011. So during that time when I found out and was referred then, we were just so consumed with you know, our time into the house and, you know, having
life.
Yes.
Yeah.
So
with life.
yeah, that slipped my mind. So
Yeah.
I actually wasn't able to, you know, go back.
Yeah.
And then when we got settled in with the new house and everything, we just,
Yeah.
it was just
Yeah, I know. I know the feeling.
totally forgot about myself.
Moving to a
and
house.
having to deal with, all, you know, making sure that the kids were, you know, as far as their
Right.
health and welfare. Yeah, I totally forgot about myself. So
Yeah. Well, it's a good thing they caught it. You know?
Yes.
Yeah. So when you found out, or when your doctor had detected something and you got referred to Dr. Miller and all that, what were some of the, I guess, what were some of the steps that they told you would need to take to address the issue? This was prior to you even finding out you were pregnant. What were you expected to be doing?
Well, once I was referred and I met with Dr. Miller, we did talk about having to go through a colposcopy, a series of colposcopy. Basically, those are just procedures that they would just test the balance of the cells within my cervix area. Excuse me. And then when she did the first one, we already determined that there's a chance that I do have precancer cells. So she wanted to do a conization, to which is what happens with that. The procedure is just to take a piece of my cervix and have it sent and tested for any cancer cells.
And this is kind of like a biopsy.
Yes.
Essentially,
Yes.
it's a biopsy.
Yes.
Okay. So at that time, you know, I can imagine, you know, you're probably nervous, you know, concerned, scared about the results when they come back. And right before you were going to get all of this done, something happened. Tell us about that.
I got sick. I had a bad case of the stomach flu, or so I thought it was. I was so weak and so much pain, I couldn't stand or eat or anything. So Ruel had taken me to the clinic, and they did a series of tests, lab works and everything. They went full on.
Yeah, because they didn't know what it was.
No,
and
they
then
didn't know what was
they're
causing.
on top of that suspecting that there may be some precancer cells in there as well.
It could be, or they could have, you know, they were also suspecting that it could have been my kidneys. That I had some kind of infection. So, like I said, they already did all the series of lab work, and then they sent me over to radiology. So while we were waiting to be seen over at Guam Radiology, I received a call from the physician, and that's when we found out about baby. And yeah, that was a surprise.
Yeah,
it was.
Yeah,
Because I guess my reaction was like, whoa.
Yeah.
Like, I didn't expect that. And
Yeah.
I turned around and I told Will, I was like, we're pregnant.
Oh.
And
What was his reaction?
we were just like blanked minded.
Yeah.
Like, we didn't know
You didn't know what to.
Yeah, it was just.
Because on the one hand you've got this, and then on the other hand you've got baby on the way, great blessing and all of that. So when you found out you were pregnant, how did that for as far as trying to diagnose or trying to find out what was going on with your cervix, how did that all have to change?
It had to stop.
It had to stop.
Prior to the pregnancy, we had already scheduled the colonization and the biopsy. But when we found out about baby, I immediately told my doctor, and we had to cancel it till further notice, basically until after I had given birth and see how things went afterwards.
Did she explain to you why it was necessary to stop?
Because it's not safe for the pregnancy, for the baby or for myself. So throughout the pregnancy, I was being monitored. And I did have like at least 2-3 colposcopies done just to ensure that whether there are any changes within the the balances of my cells inside. So
and with those testings, did they find anything?
No, everything was still the same as
okay.
when we first we first had the colposcopy done.
Right. Okay. And a colposcopy, that procedure is considered safe even during pregnancy, I'm assuming.
Yes.
Okay.
Otherwise, they wouldn't have.
They
done
wouldn't
it,
have
and
done
I
it.
wouldn't have,
Right.
agreed to having it done.
Exactly.
Yeah.
Exactly. And so, throughout your pregnancy, the 9 months, what was that experience like? Kind of being pregnant, having a child growing inside of you, and at the same time, having to hold on to, put a pause to figuring out also what was going on. What was that like for that 9-month period?
It was really hard. It was really hard to deal with as far as dealing with morning sickness. There was a bad case of morning sickness. It was just overall different than any of my previous pregnancies. And having to wonder, if anything would progress.
Right.
As far as like before I found out about cancer, do I have cancer? How would it affect, if during the pregnancy and everything, and then afterwards, there's a lot of things just going through. I was just overwhelmed with so many different thoughts, negative, positive, and how, about what would happen if, before, baby's born, after baby's born.
Right. The future
so,
and all of that. What got you through it?
Well, family. And
Ruel, I'm sorry, ladies and gentlemen, Ruel's your other half.
yes, sorry. Sorry. My children, my family, and of course, all the full-on support from our families and our friends. Yeah. Those who were in on what was going on with me.
Yeah.
So.
And so, towards the end of your pregnancy, what month did you give birth?
September.
Okay. So towards the end of your pregnancy, as your belly is growing and all of that, what did your doctor have to plan ahead for the delivery, given that you may have some sort of situation with your cervix?
Not necessarily. The only thing that we did plan ahead was the surgery date, because I had to have cesarean.
You had to have cesarean. Was it because of they didn't know what was going on with you, so it had to be cesarean, or they didn't want to risk a natural birth?
Well, yes, that they didn't want to risk a natural birth, only because I've already had 3 cesareans, and you have the maximum allowed limit of cesarean is 3. You have to have 3. Once you're 3, I was told that you're cesarean for life. So that's the main reason. I was kind of a little bit bothered about it, because I wanted natural birth.
You wanted to be able to give birth naturally.
But other than that, it had nothing to do with whatever else I was going to previous.
Right. Okay.
pregnancy, yeah.
Okay. And so then, delivery. When you gave birth, what was that like? I mean, I know it's a magical time, but when you finally got to see your son,
it was the most I was upset at first, because I didn't see my son until about 6 hours later. I delivered. Yeah, I was just under.
Oh, yeah, I'd be upset too.
Because I had cesarean and I was still under the influence of the anesthetics and the painkillers and everything. I was groggy. And initially I wanted to breastfeed. So I was waiting for them to bring my son in, and I was even getting upset because nobody was bringing my son in. So finally we were able to. And when he finally came in, that was like 6 hours after he was born. I was just overwhelmed. Like I'm so happy. I felt, still like surreal. Like I didn't know. Wow, I actually have a son.
You have a son.
Yeah.
After 4 girls, you finally got your boy.
Yes.
All right. Well, thank you for sharing, the journey before the diagnosis, and we're going to be right back. We're going to take a quick break, and when we do get back, we're going to talk about after the delivery and the diagnosis. So, my story will be right back. And welcome back to My Story. I'm Janella Carrera, your host, and with me again is Miss Leilani Pakaigui, and she is currently battling cervical cancer. And earlier, before we went to break, we talked about, prior to the diagnosis and when you were pregnant, and you just gave birth a few months ago. And so, as I understand, after you gave birth, that was when they were able to proceed with officially diagnosing and finding out what's going on with you. So, how long did they have to wait after delivering the baby?
Well, my doctor wanted to do it immediately, but we were only open to 2 months later.
Okay.
Yeah, we were based it on Guam radiology, whatever appointment date they had available. So,
okay. And that was the appointment date they had available to do.
So we did it two months later after he was born.
Okay.
Yeah.
And so you had to deliver a cesarean, which it's a difficult recovery. And you also have this newborn. And then in the back of your mind, you don't know what's going on. And you're about to go in for a testing biopsy. That must have been really difficult, all those challenges in front of you. What was that like for you?
I was pretty much numb. Like, I just want to get it over and done with. Yeah. Honestly, it was, do it. Just do it.
Yeah. Just get it over with.
It didn't, for me at the time, it was like, if they found something, they found something. If they didn't find anything, well, that's good. Yeah. But it was just more of numb in between. I was like at a neutral feeling between, anxious and, really hopeful that nothing is wrong with me and anything like that. So. Yeah.
And then when you did finally have to go through with first of all, when you do the, what do you call it?
The conization.
Conization. Yes. Okay. How long does it take for the test results to come back?
Well, that one took about 2 weeks.
Oh, wow.
Yes.
That's a long time.
You were going to ask me how long was the procedure. So I was like 1 hour, which I wish that, the results came in within 1 hour.
1 hour as well, yeah.
But it took 2 weeks.
And is that because they have to send it off island?
They sent it off island, yes.
I see, okay. So otherwise, they probably would have been able to get it much sooner if we were able to test here in Guam.
They did test here in Guam, but the lab tech, actually, the doctor, he did have suspicion, but he wanted confirmation. And, I guess
see. And so he sent it.
Yeah, looking at it as like a second opinion.
Right.
So, yes.
Okay.
And then when the results came back, it was confirmed that.
When the results came back, what were you doing? Tell me what was going on when you found out, the very moment.
Well, I got a call, like last minute phone call, come in and see me at this time, I was like, yeah, sure. And so I come in and not knowing that, what I'm going to hear, I expected that I would hear some kind of bad news, but.
Did you go in by yourself, or
no,
you brought Roel with you?
Roel was with me. And then my doctor, we had another doctor. She was the one that actually, Dr. Jensen was the one that actually got the news to me. Okay. I'm sorry.
It's okay. It's okay.
When she did announce the news, they explained that they were kind of hesitant to tell me because it was right around Christmas time.
Oh.
Yeah, so we found out two days before Christmas.
This is just this past Christmas.
Yes.
Wow. December 23.
22nd.
Oh, 22.
22nd, 23rd.
Yeah.
One of
Around
the
that
two.
time.
So,
Yeah.
yeah.
The week of Christmas.
Yes,
Yeah.
the week of Christmas. So that was a little bit heartbreaking and disappointing at the same time, you know.
How do you celebrate when you're getting told something like that?
Yeah. So during that time, there were only 4 of us that knew about it, and we, you know, I just wanted it to stay that way. Didn't want to ruin anybody's holidays, or, you know.
Yeah. What was your plan, to maybe wait till after Christmas?
No, I didn't actually want anybody to know.
To know at all?
At all. No, I didn't. I didn't want, you know, I was thinking that I didn't want treatment or anything like that. I just
You didn't
wanted
want to be
do
treated
it.
differently.
Yeah. I didn't want anybody to
You
feel,
don't want the pity card and all this
no,
stuff. Yeah,
or
you just,
feel obligated to come, you know, assist or anything like that, or feel. But through so much consultation from, you know, Ruel and his mom, my mom, you know, his other family members, they finally changed my mind. So.
And so you finally opened up about it.
Yes.
And I know you had a fundraiser actually not too long ago that, you know, Ruel helped put together. And
Yes.
so going from not wanting really anyone to know, and then a fundraiser where everybody, you know, comes in and supports you, what was there a difference in you know, the way that you carried it around, you know, the knowledge?
There was. I mean, there is a difference. Yeah, just seeing how much, you know, people out there are, you know, willing to support you in any way that they can is really touching.
Yeah.
And motivational. You know, having and seeing, making you see a different aspect of what you were actually seeing at first.
So it really helps.
Yes,
it helps to open up and get help from others as well.
Yes, it
That's
does.
good to know. Yeah, that's really good to know.
I actually felt like I was running for governor that night, but other than that, it was.
Well, maybe you can.
Yeah, and, you know, I don't like to be in the spotlight. I mean, there I was, being in the spotlight again.
Right. So, okay, now that you, you know, you covered the diagnosis, and then you opening up about what the diagnosis was to your family and to your friends, and then, you know, to the community, I guess you could say. What are the next steps now that we know what it is officially that they found, and what did they tell you have to do as far as treatment? What is a prognosis?
Prognosis I would have to go through a hysterectomy. Unfortunately, I would have to have my uterus removed, even as much as I really wish it wouldn't have to be that way.
Yeah.
We are going to have to go through it. So right now we're in the process of doing our travel arrangements, and
so you'll be doing this off island.
yes,
Off island. Okay.
we have been referred off island for it.
I see.
Only because we do have medical oncologists here, but because my doctor had stated, and they did their research here, there's no gyno-oncologists available here in Ireland.
I see.
Yes, and they don't have the proper equipment on island to
do it here.
perform the procedure.
Okay.
To
So it's not just a typical regular hysterectomy.
No.
This is, you know, and
I'm sorry. My doctor actually just wants to make sure that you know there's no possibility that it could reoccur.
right.
Yeah.
Right. So hysterectomy, and I'm assuming here, but would it be safe to say that it's to prevent any spread of the cancer cells?
Yes.
Okay.
Yes.
Okay. What about as far as other medication treatments like chemo or radiation? Is that something that you guys will have to do as well?
Eventually, but until then, you know, we'll just take it one day at a time, one step at a time, and as you know, the days go by and what the doctor recommends or the specialist recommends what we need to do.
So the next step would be the hysterectomy.
Yes.
And then from there, you'll figure out and maybe discuss with your doctor other treatment options.
Right. Basically, go as you go with the flow kind of thing.
Yeah. How do you feel otherwise? I mean, you know, you've got a 4-month-old baby. You've got 4, you know, beautiful girls. You're still working.
Yes.
And you're nursing. That's correct.
Yes.
And you've got, you know, this lingering around. What's life like right now for you?
What's life like? I don't know. To be honest, I'm just, you know, just going with it. There are times I do get upset. I mean, I'm angry and everything, but
Naturally.
other than that, it's all about accepting the inevitable. Sorry, excuse me, but it's
One step at a time,
so,
one day at a
it's
time.
a crazy road,
Yeah.
actually.
Yeah.
It's a crazy road to just go through, and so
What about-
hopefully we can just get through it.
Yeah.
And get over
What
the
about your
one.
girls? Do they know?
They know. My daughters know. They've been very helpful as far as helping me with their brother. They love helping me with my brother. My oldest daughter is always constantly calling me and saying, "Mom, are you okay?" Making sure I'm fine. She offers to do a lot of things without being asked, only because she think make Mom a little bit more comfortable than I deserve. But other than that, they're really good help. Very, very big help.
That's wonderful. Have they expressed any kind of emotions or feelings to you?
No, not that I've seen. I mean, they're being really strong for me,
Which helps you?
yes. But at the same time, sometimes I wonder if,
They may be hiding it.
what do they really think about it? Yeah. How do they really feel?
Yeah.
So they're like their mother. Try not to show it. Yeah.
Try to keep it inside.
Yeah.
Yeah. Well, Lonnie, thank you so much for joining us and sharing with us your story. And we wish you the very best of luck.
Thank you so much.
Blessings on your journey, and we really hope that everything will heal and you'll be on your way to a wonderful life.
Happier days.
Happier days.
Happier
Indeed.
days.
Your son is so adorable. He's so cute.
Thank
Looks
you
like his
so
dad.
much. Yes. Thank you.
All right.
But
Well,
thank you for having me. Yes.
Thank you. Thanks, Lonnie. All right. Well, that's Lonnie Pukagwi. She just shared with us her story about being diagnosed with cervical cancer. We wish you, again, a safe journey on your travels and healing. So we'll be right back with my story. I'm Janella Carrera. Thanks for joining us. Thank you so much once again to Leilani Pukagwi for sharing her ongoing cancer story. Earlier in the show, she shared with us that just this past December, she was diagnosed with cervical cancer. So to fully understand what cervical cancer is, we tugged at the knowledge of local OBGYN, Dr. Thomas Shea. All right, thank you, Dr. Shea, for joining us here in My Story. We're here to talk about cervical cancer. We interviewed a warrior who's currently battling cervical cancer. So I wanted to begin with, if you could explain what the cervix is. What does cervical cancer affect?
Sure. When you talk about female anatomy, the cervix is part of the uterus. It's the exit part of the uterus, and it's attached to the lower segment of the uterus. So just part of the anatomy. So cervical cancer occurs, that section of the uterine cavity is towards the outlet of the uterus. Okay. So when we talk about cervical cancer, we only talk about that specific area only.
Just that area? Just
that area only.
And does it cover, I know you mentioned that there's an outer layer and there's also an inner layer on this?
Yeah, there is actually what they call the exocervix, which is on the outside, and then there's endocervix, which is the lower part of the uterus that leads into the inner side of the uterus.
Okay.
And that's the segment right here. I can show it to you here. If you look at this is the entire uterus. This is about twice the size of a normal uterus. And if you look at the lower segment here, this is the outer edge, this is the vaginal area, and this is the cervix.
I see.
And this is the cervix, which is the outside of the cervix. Inner cervix is inside here. Okay. And this is where the most aggressive form of cancer that occurs. So, and that's the entire uterus here. So when you spread here, you can spread into the uterine cavity, you can spread it outside here.
I see.
And a lot of time with a bulky lesion, it's actually spread out into the vaginal area. Okay. But that's where the cervix is.
Okay.
Yeah.
So for detecting of cervical cancer or any kind of abnormalities, what are some tests that are performed?
Well, in today's day and age, no one should be getting cervical cancer. But unfortunately, in the United States, approximately 12 to 13,000 new cases of invasive cervical cancer are diagnosed each year. Oh, wow. And over 4,000 of those cancer cases actually die. Wow. So we still have undetected cancer, but that's decreasing. And the reason why it's decreasing because we do a very good job in the United States about doing Pap smears. Right. And Pap smears, since the Pap was invented, the cervical cancer has actually gone way, way down, and that's because of early detection. Right. If we can pick up your cervical cancer early, we can cure you. And oftentimes, you don't even get to the point where you get cancer. Because what the pap smear tells us is that, hey, there's an abnormality. And if there's an abnormality, you want to follow a colposcopy. Colposcopy is where we look at and magnify the cervix with a microscope. And we biopsy the cervical area, and we can pick up cancer very, very early at the precancerous stages. And with a minor procedure, you can actually remove those lesions, and you shouldn't cancer.
Oh, okay. So with the pap smear, you can actually detect what you mentioned, pre-cancer cells, before they even turn into cancer.
That's right.
And it may not turn into cancer, but to be able to remove it to also lower the risk of it developing into cancer.
That's right. That's right. And it's all about surveillance. And you know, the question is, oh, can I get cancer in a few years or a few months? No, you can't. You know, but I think what you can do is look at the history of cervical cancer. It's not just a few years. It's over 5, 6, 7 years period before you develop into cancer from an abnormal lesion. So when you skip a pap smear, and the recommendations, we'll talk about that a little bit. The recommendation for pap smear now is that if you're under the age of 21, you don't need to do a pap smear. But you still should see your gynecologist once a year for annual physical, for annual women's exam. That's very, very important. But if you're between the age of 21 to 65, the recommendation now is do a pap every 3 years. But still, annual visits, annual women's exam, those are key. But if you have high risk, if you're a smoker, if you have history of cancer cells in your cervix or precancerous changes, certainly you have to do those pap smears more often. And that's key. Oftentimes people forget, oh, that's 3 years, but 3 years becomes 5 years. 5 years becomes 7 years. And then before you know it, you go, oh, I haven't had my pap smear for 10 years. And that's critical because cancer can develop within that period of time.
So if, for example, you say, you mentioned that the new recommendations are before the age of 21, you don't necessarily need to get pap smear. But if you have, say for example, you have a history, maybe a parent, a mother or an aunt or someone who had was diagnosed with it in the past, would that require?
Well, certainly any cancer in the family history, you got to surveil it much better. But the genetic aspect of cervical cancer had not been really well understood. Very different from ovarian cancer, very different from breast cancer. But if you're under the age of 21 and you're sexually active, what's more important for you to do is making sure that you get your STD, sexually transmitted disease, tested. And there is a particular virus that we're homed in on when we talk about cervical cancer. And that's a human papillomavirus.
Very common, I hear.
Very common. In fact, that is the number one sexually transmitted virus in Guam and across the country and probably across the world. And there is a vaccine now. There are actually 3 vaccines. But the most common one is Gardasil, which is a vaccine with 4 types of viruses they protect. There's a new one now called Gardasil 9, which protects 9 viruses. Now, our office was the first one to actually bring the Gardasil to Guam. In fact, when it first came out, it was very controversial. And insurance didn't want to cover it. And I had to go fight for this. I had to advocate for it. And this is one of the things that our office does, is we advocate for what's innovative and what can save lives. And the Gardasil vaccine today is saving lives.
At what age do you recommend women?
Well, the recommendation for vaccination is between age 11 to 26. That's initially. There is a study that's going on now up to 40. But you want to catch before they become sexually active. 11 is kind of young, but that's what they recommend it. And the reason they want to do a younger stage is because the cells are more, the stem cells and the reaction to the vaccine is much better. You can develop the immunity much better. But usually in our office, we usually see patients between 15 to 26.
Now, HPV is, it's common knowledge that that is a contributing factor to cervical cancer, but could a woman be diagnosed with cervical cancer who's never had HPV?
Oh, absolutely. Absolutely. In fact, we had a patient who has never had intercourse, but she developed cervical cancer, and that was a very rare case, actually. And the recommendation is that, well, if you don't, have any HPV related, one of the guidelines is that if you're between age of 30 to 65, you can actually go ahead and get what we call HPV co-testing. And if you do a pap smear with a co-testing for HPV virus, if that is high risk for HPV, then you have to surveil that better, do colposcopies or see whether there's high-grade lesion or not. If it's negative, you can skip a pap smear for 5 years. I really don't know if that's a good recommendation or not. History will tell. Now, guidelines would change. Just like mammogram guidelines change. So it's very interesting how the medicine research will swing things back and forth. We used to give estrogen replacements for women, postmenopausal women, all the time. Now we say no, but it's coming back. The estrogen replacement is now coming back. But as far as HPV goes, is that it's very important to recognize that cancer still can happen. But majority of cancer is HPV related.
I see.
And high risk ones are, it's increasing. We keep typing them. It's more than, I don't know, a dozen, maybe 40, 50 types of high risk HPV now.
Oh, wow.
They're actually, but we only protect 9 of them because vaccines are being developed. But it's interesting to see all these high risk types coming out. But there are genital warts that's not aggressive enough to turn into cancer, but those are a concern too. So when you have intercourse with multiple partners, your risk of getting cervical cancer multiplies.
Also increases.
Smoking as well. You need to make sure that you don't smoke.
And my final question, Doc, when a woman goes in for a pap smear and say the results come back positive with either HPV or some kind of abnormality, what's the next step for that woman?
Oh, you make sure you listen to your gynecologist.
Yes.
You got to make sure you follow up, because if a pap smear comes back abnormal, depending on how abnormal it is, you got to make sure you get what we call colposcopy done. Colposcopy is where we actually take a look at the cervix and take a biopsy of the cervix. The reason why is a pap smear is just a little scraping, just like the skin. There's a little scraping of the cells on top of it, but the cancer could be growing underneath it. So you have to look at the with the microscope and take a look at the cervix, very, very close detail. So, but you got to go to somebody who's very experienced.
I see.
Because you have to look at that day in and day out, and you have to make sure you target the biopsy in that specific area.
In that particular area where
That's
it was
right.
found.
If it looks abnormal, you biopsy it, and that's the key. Because if you can miss a lesion, that can cost somebody's life. So you don't want to miss. If it's perhaps it's abnormal, make sure you check with your gynecologist and follow up. Don't skip it.
When was the last time you had a patient? You see a lot of women here in Guam.
Yeah.
A patient with cervical cancer.
Well, majority of the patients that I see with cervical cancer actually are coming in for consult after it's too late. But if you follow up with me from the very beginning, if you're an established patient with me, I always tell patients, I'm not going to let you get cervical cancer if you follow my advice.
That's a very heavy promise.
It is a heavy promise. But if you listen to my advice, you follow your pap smears, and you don't smoke, and you listen to my advice, you should not get cervical cancer. And if you do, we can detect it early, and we can cure it. So I always say, is there a cure for cancer? There is a cure for cancer, and that cure is early detection.
All right. Well, thank you very much, Dr. Shea, for very knowledgeable expertise and story and.
You're welcome. I think that was the longest take because I had to write out for 2 deliveries.
More time to ask you questions. Well, thank you again for sharing all of that with us. Well, we here at My Story aren't the only ones fighting to bring awareness to cancer and cancer prevention. So thank you to Dr. Tom Shea and Guam Cancer Care. Along with these great individuals and their organizations, we all work together in hopes to end cancer once and for all. Before I close out the show, here are some great local organizations working to assist patients diagnosed with cancer and their family members. These organizations are committed to the fight against cancer on Guam. Well, that's the show. Again, a huge thank you to Leilani Pokaigwe and her family for allowing us to take a look into their lives. We wish Lani safe travels and best wishes during her battle. Until next time, eating right and living right is the best form of cancer prevention. From all of us here at My Story, adios. Good night.